social development, particularly in pension systems and health systems. These have been key in the response to the impact of the pandemic and have contributed on the need of moving to universal, resilient, sustainable systems of social protection, and that in the center of countries. The evidence, it's urgent to place these systems for universal access with increasing levels of equality, financial sustainability, all that guaranteed. That calls for an understanding of these systems as something key for sustainable development within the framework of welfare states. It has been key to develop this debate where we bring together efforts with international agencies at this historical moment for the region and the world, when there is uncertainty growing and where we need to have certainty, guarantee the right to pensions and health and social rights so that we can move towards sustainable development with equality. So I start by introducing first our in, Executive Secretary, Mr. Mario Timoli, for your opening statement. Thank you, Alberto. Thank you, everyone. I will not repeat all the greetings of Alberto. Truly, for us, uh, I'm interested in putting in the center this event has a very important role and reputation. Based on that, we need to generate greater collaboration and better processes of joint actions. We are fully convinced, and we will see this in the presentations ahead, that the context that is coming is difficult, and certain improvements obtained in the last 10, 15 years for Latin America, very likely all of them, will be blocked or reversed, or the indicators we have regarding social context, be uh, indicators on poverty, inequality, or access, or welfare system that at some point could be retracted, could go backwards. And that is why we are so concerned. This seminar places us in the correct moment in a situation of raising voices, substantively, I mean, practically with instruments, in a context where the social part will be downgraded. And that part with an impact on population, it's something that is very strong reality for ECLAC and for our partners. To do this now, it's putting a difficult subject on the table. It has to do with growth, what is happening in the labor market, what is happening with informality, with access to retirements and welfare system. All of that places us in a tremendous concern. And thus, holding this event is of great importance to reach all of us together, to have a dialogue with the governments. What policies are being formulated and put social policies at the center. That is the objective of this event. To have this event before damage occurring to society, before uh, poverty and inequality reaching very high levels. So it is like an alarm. We've had this seminar and a special event where this it's an alarm where we may face indicators going even further down, and the need is to act now. So welcome Clarissa, Fabio, Volker, Jutta, that probably will connect or send a video. Thank you for being with us. I think that having had the possibility of holding an event like this is important to know what is happening in the labor market, what is happening in health, what will happen in the future, and places us in a cooperation network. It's an important seminar. I repeat this. It is a seminar that is about let us have our voice of alarm, but because what may happen, a warning voice. If we don't do this now, we don't have an alert on this subject, many things will not be able to be reversed. So it is now that we have to adopt policies that address the topics. Thank you for being with us. And thank you. Let us have policies and work with our governments and our network. And let us all be able to work with their countries so that at least we will moderate the effects of this cumulative and protracted crisis. Thank you very much for being with us. It is a pleasure for ECLAC and have partners like you. I mean, it's really a great pleasure to be with you.
Thank you, Mr. Mario Cimoli, Acting Executive Secretary, for your welcoming words and for being with us here during the second regional seminar on social development. And I highlight from your words the need for a dialogue, to turn the seminar into a dialogue vis-a-vis a long-winded crisis and the need to have universal social security and social systems that are sustainable and resilient. And now I would like to offer the floor to Mr. Fabio Bertano, Director of the ILO Office for the Southern Cone of Latin America, for his opening words. Dear Fabio, thank you very much for your support. And you have the floor. Thank you, Alberto. Good afternoon, good morning, everyone. I would like to especially greet Mario and Clarissa, who are both present at this seminar. I would like to, first of all, congratulate ECLAC and the Social Division, Social Development Division, for organizing this very important seminar in accordance with the last ILO report on social protection 2020-2022. And despite the unprecedented expansion of social protection during the crisis generated by COVID-19, more than 4 billion people in the world are completely unprotected. In various reports, we have documented how the response to the pandemic was unequal and insufficient, and increased the distance between high-income and low-income countries, and unable to provide the fundamental social protection for all people. Our director of the ILO has stated that this is the right moment to use the response to the pandemic so that we can build a new generation of social security, social protection systems based on rights, as you mentioned, Alberto, and also was confirmed by Mario. These systems can protect people from future crises and provide both workers and corporations the certainty that they can face up to future emergencies with confidence. Social protection is fundamental for social justice and for decent work, but also for the creation of a sustainable and resilient future. In consequence, I reiterate, we cannot but share this initiative by ECLAC, accompanied by our colleagues from the WHO and ILO, and also European and German cooperation, in order to establish a dialogue and reflections around the issue of social protection systems in the region. As you mentioned, Alberto, the idea is to deal with diagnosis and strategic guidelines for the reform and restructuring processes in pension systems and health systems within a context that is certainly uncertain of recovery and probably insufficient, and with a need to guarantee for the exercise of social rights this set of instruments. It is also important to mention that the insufficient and unequal recovery of labor markets, with the existence of informality and with a smaller fiscal scope and the slowdown in the economy as a result of the world context and as a result of factors that are endogenous to the region, have created a context that forces us, together with ethnographic and productive transitions, to reposition these debates when it comes to social protection. And the ILO continues to support the adoption of the regulatory framework of social protection and the Convention 102, which establishes parameters in order to develop national social security systems, together with Recommendation 202 on national social protection floors, emphasizing the aspects related to universality, sufficiency, sustainability, and participation. And countries in our region have indeed been adopting and ratifying these agreements. Paraguay, for example, last year ratified Agreement 102. And so they continue to be in force, and our intention is to be able to contribute with that. And finally, I would like to benefit from this situation to greet all participants in the seminar with the expectation that we may obtain learnings, new knowledge from panelists, and we renew, as from the ILO, our commitment to accompany and support processes leading to social transformation and to support these policies and leaving no one behind, together with ETLAC and with PAHO and the WHO. Thank you, Fabio, and the whole ILO team that is supporting us with the organization of this regional seminar. And as you have said, the idea is to guarantee the right to social protection, and this must be at the very center of sustainable development strategies in our region. Now I have the pleasure of offering the floor to Carissa Etienne. She's director of the Pan American Health Organization, for her opening remarks. Dr. Etienne, you have the floor.
Thank you, Alberto, and good afternoon. And let me recognize the ministers of social development and protection, ministers of health, and all the representatives from all of the other sectors, including social security. All of our partners on this opening panel. And certainly, let me greet my friend Chimole. Good afternoon. And thank you for asking PAHO to be part of this process. The region of the Americas has passed through historic and transformative periods over the centuries that have shaped the very structures and the foundations of countries and societies that we see today. And as the region began to emerge from colonialism, a period that commenced somewhere in the early 1800s and continued through into the 1970s, so too did the quest for self-determination, social participation, and greater fairness and equity in society. The journey that we have passed was not smooth, with the foundations of new democracies being broken down, rebuilt, and reshaped over the years. But central to the success of these processes has been the construction of states built on the solid foundation of human rights, solidarity, and inclusion. And this history, I think, is important as we begin to emerge from what has been the most devastating period in recent times for this region in terms of lives lost, the impact of the COVID-19 pandemic on well-being, on at this point are very clear. Of all the WHO regions, the Americas reported the highest number of cases of COVID-19 with the highest number of deaths recorded. And as labor markets collapsed and unemployment levels soared, millions of households throughout the Americas faced catastrophe over a 2-year period, with families unable to buy food, pay rent, or indeed have their health needs covered. Out-of-pocket expenditures in healthcare during this time caused many to fall into poverty. As the region now begins to emerge from what is the worst of the pandemic, the road to recuperate lost gains in health and social development will be long. It may be difficult. The Pan American Health Organization is the specialized agency in health of the Inter-American system and the regional office of the World Health Organization in the Americas. During the COVID-19 pandemic, we worked day and night to support our member states in tackling COVID-19, in reorganizing health systems and services, surging hospital capacity, and providing life-saving personal protection equipment, diagnostics, and vaccines. We scaled lab capacity and genomic surveillance, deployed emergency teams to countries throughout the region, and provided capacity building to more than 1.9 million health workers through our PAHO virtual campus. Let's be clear, the threat of COVID-19 still remains, and therefore we must remain vigilant. But as we begin now to look forward to a period of recuperation and recovery, I believe that there are two critical issues that we must address. Firstly, the time for substantive transformation of our health systems is now. The COVID-19 pandemic has shown that our public health infrastructure was not prepared, and our health systems fragmented, segmented, and under-resourced. And this has been well documented, assessed, and reviewed by PAHO, WHO, and by our partner organizations. Health systems transformation must occur now and must be founded on the principles that everyone in this region has the right to health, and that this right is universal, and that the structural and institutional barriers that have been constructed to impede the realization of this right must be broken down. Universal access to health and universal health coverage based on the foundations of primary health care is a right. It is necessary to protect our economies and our societies, and it is necessary to ensure preparedness and resiliency in the face of future pandemics. Secondly, the interdependency that is so evident between health and social protection must be made explicit in national policy and action. COVID-19 has highlighted the urgent need to deepen the linkages between health and social protection, and in particular, the joint action of health authorities with those responsible for social security and protection. The health and well-being of the peoples of this region requires the creation of universal, solidarity-based financing mechanisms that pool the risk and resources and protect those that are most vulnerable with equity. And this is nothing new. When we look at the public financing in health in the region, it increased over the past years from some 2.5% to some 3.9%. And this is a significant augmentation in the allocation of much needed resources to health in the Americas. However, it is still too low when compared with the OECD countries and with the 6% benchmark that the Americas set for itself in the PAHO governing bodies in 2014. What we see that with low public investment comes high out-of-pocket expenditure in health. And that is the most regressive form of health financing for health systems. Out-of-pocket expenditures in health can result in catastrophic household expenditures, increasing poverty levels even further. Addressing these high levels of out-of-pocket expenditure in health constitutes one of the foundations of financial and social protection in health. In September 2021, our PAHO member states adopted a landmark framework to increase the resilience of health systems for the future, while recuperating lost public health gains that were observed during the pandemic. Our member states recognize that the health sector alone will not achieve what needs to be done to recuperate, to close the gaps in health and poverty, and to accelerate towards recovery. Intersectoral action is fundamental to support health, social, and public financing functions that address social, economic, and environmental determinants of health. That government action to reduce the level of informality in the region's economies is required to accelerate poverty and the development or strengthening of social protection programs and mechanisms, including those for income security that protects the most vulnerable populations. the strengthening of social, environmental, and economic protections that are related to health, including the targeting initiatives to address the generational issue of the long post-pandemic recovery of children and youth. The strengthening of these protections must also be central to intersectoral pandemic preparedness and response planning to ensure that populations remain protected in the event of future public health emergencies. And preparedness to implement emergency social protection and income security programs at times of crisis are absolutely necessary to address the depth, the breadth, and the duration of public health crises, especially with respect to their socioeconomic repercussions. You know, friends, the argument is clear. Social protection policies and mechanisms that are inclusive and focused on the most vulnerable in the society provide the health protection and security in times of international public health emergencies and beyond. The effective integration of action between health, financing, and social development sectors to construct universal social protection mechanisms constitutes a priority for this region. Colleagues, the window of opportunity for substantive action is small. And so the time for action, and we must stress this time is now. AMPAHO stands with you to support you in the transformation of health systems, to build resiliency, to improve preparedness, and to improve health for all in this region. And we are more than ready to work across sectors with our partners such as ECLAC, ILO, etc., in the structural transformation of social protection policies and mechanisms that will contribute to more substantive health protection in the Americas. Let me take this opportunity to wish you much success in your deliberations at this international seminar, because these deliberations are central to the continued development of our countries, our states, based on foundations of human rights, solidarity, and inclusion. Thank you again for inviting us to be part of this exercise. Over.
Thank you very much, Doctora Etienne, for your participation in this opening session y sus importantes mensajes como...
An important message, just as the moment of transformation of health systems is now, is essential to guarantee the right to health, and it's essential to recognize the interdependence between the health and social protection. Thank you so much, Dr. Etienne. Now, we thank for the participation of Mr. Volker Huber, Director and Commissioner for the Middle East and North of Africa, Southeast Europe, Eastern Europe, and Latin America for the German Federal Ministry for Economic Cooperation and Development, BMZ, who has sent a video to greet you all.
Dear Mario Cimoli, Acting Executive Secretary of ECLAC, colleagues from ILO, PAHO, and the European Commission, participants, ladies and gentlemen. I'm very pleased to have the opportunity to greet you on the occasion of the opening of the second regional seminar on social development. At the German Federal Ministry for Economic Cooperation and Development, BMZ, it is our goal and ambition to address the most pressing global challenges together with our partners around the world. In our current political priorities, we focus on the recovery from the COVID-19 pandemic, on its consequences, on combating hunger and poverty, on a just transition to more sustainable and climate-friendly economic models, as well as developing a feminist development policy with a focus on gender equality. In this sense, we share ECLAC's call for the importance of growth with equality, or, as formulated in one of the position papers of the Commission, a transformative recovery with equality and sustainability. At BMZ, we are alarmed by the strong negative impact the COVID-19 pandemic had and still has on economic, social, and environmental development efforts towards a more sustainable and just world. not only that the pandemic jeopardizes the expected progress towards achieving the Agenda 2030 and its 17 goals, but it also puts at stake past successes. Poverty is one striking example. After decreasing significantly over the past decade, it is on the rise again in many countries of the region due to the COVID-19 pandemic. It is accompanied by increasing inequality, low economic growth, low productivity and informality, and hence hindering the well-being of the people. Adding to that, the Russian attack on Ukraine impacts significantly on the quality of life of many people all around the world and in many countries of the region. Specifically, the most vulnerable population is faced with sharp increases in the prices of basic goods such as food, energy and transportation. The challenges this implies for the democratic governments are increasingly demanding. With the recent experience of the COVID-19 pandemic and with the prospect of a new crisis on a global scale, the ambitions of the 2030 Agenda and its promise to leave no one behind become even more important. Many goals of international cooperation can ultimately only be realized with effective social protection systems. When we think of the Sustainable Development Objectives, social protection systems play a crucial role, especially for the goals to end poverty and hunger, to strengthen good health and well-being, as well as to achieve gender equality. Even when we talk about a just transition towards a green economy or a big push for sustainability as stated by ECLAC, it is essential to bear in mind the importance of and implications for social protection systems. In a world where the gap between the poorest and the richest tends to become wider and wider, beyond ethical considerations, there are also very concrete and obvious reasons to promote solid, resilient, and universal social protection systems, social cohesion, and social peace. Social protection can ultimately be understood as a key element of good governance, especially in times of crisis. Through regional cooperation mechanisms with powerful and recognized partners such as our strategic alliance with ECLAC, Germany contributes to regional integration processes and structural changes, creating ties of cooperation in various areas of public policy, with social policy being one of them. To this end, we are convinced that it is essential to create opportunities for exchange and mutual learning between countries and regions on the experiences and challenges faced by the different countries. Lastly, for strong, effective and efficient social protection systems, sustainable financing mechanisms are essential. And it is often here that countries face the biggest challenges, whether in Europe or in Latin America and the Caribbean. That is why I am very happy that the State Secretary of the German Federal Ministry of Labour and Social Affairs, Dr. Rolf Schmachtberg, has been given the opportunity to participate tomorrow in the framework of Panel 2, as I am sure that more than one aspect of the challenges that the German pension system faces today is shared by some countries in the region, such as demographic change, to mention at least one. To conclude, I have no doubt that this will be a highly successful event. I wish you good and enriching discussions. From our side, we will keep working to ensure that the strategic cooperation between ECLAC, the countries of the region and German cooperation continues to support important inter-regional exchanges such as this one. Thank you very much.
Muchas gracias, señor Volker Judel.
Thank you so much, Mr. Volker Judel, and we share your message about this crisis and consequences. Requires a transformative economic recovery where the protection to social systems play a key role in this process. we take advantage of greeting all people who are online now. We have 260 people connected to this event, this inaugural session, 16 countries of the region: Argentina, Bolivia, Brazil, Chile, Colombia, Costa Rica, Ecuador, Honduras, Guatemala, Mexico, Dominican Republic, Panama, Paraguay, Peru, Uruguay, Venezuela, Antigua and Barbuda. A special greeting to each one of you. And to close this high-level panel, we have another video, greetings from Madame Jutta Upirlainen, who is Commissioner of the European Commission.
Dear friends and colleagues, the COVID pandemic has highlighted the need for stronger health and social security systems globally, including in Latin America and the Caribbean. On strengthening our EU-LAC partnership, social cohesion must be at the heart of it. We need to collaborate on social policies. We need to build new social pacts. This is our best way to fight poverty, counter inequalities, and foster more democratic and inclusive societies. We are not starting from the scratch. For over 15 years, the EU has tackled inequalities together with Latin America. Our flagship program, Euro-Social Plus, has helped to promote social policies, good governance, and gender equality. We have big ambitions for its successor as part of the Global Gateway strategy. The focus will be on health and education, women and youth, tackling root causes of social inequalities, and supporting decent, sustainable jobs. Dear friends, a reputed partnership benefits both continents. Team Europe is already preparing the ground for an EU-LAC summit next year. And I look forward to uniting forces, including with our trusted and committed partner ECLAC, as we take the EU-LAC partnership to new heights.
Muchas gracias, señora.
Thank you so much, Madam Jutta Upirlainen, for your greetings and participation in this opening session of this seminar that we are organizing from ECLAC with the support of ILO, PAHO, German Cooperation, and the European Union. You are all invited to participate of the discussions that we are going to undertake over these 3 days of seminar. Today, we will concentrate in social security. Tomorrow, we're going to be discussing the pension systems, and we're going to end up Thursday with health systems in the region. The pandemic is providing us an opportunity to face inequality, strengthen welfare states, learn from accumulated experience in other regions, and to guarantee the right to social security and the robust, universal, comprehensive, sustainable, and resilient system for social protection. We would like to request you to answer the evaluation survey that we're going to pass to each one of you. You're going to find it in the chat, and you're all invited to the different discussions that will take place in the framework of the 5th regional board discussion about Latin America and discussion, and this will take place in Cuenca, Ecuador, September 29th, 2022, as part of the Ministerial Forum for Development in Latin America and the Caribbean under the UNDP. We thank you for your attention and participation, and now we will continue with the second session for today, panel 1, name opportunity for a welfare state, a stronger welfare state in the region towards the construction of a universal, comprehensive, resilient, and sustainable social protection system. This will be moderated by Fabio Bertano. Director of ILO Office for the Southern Cone of Latin America. Thank you, Dr. Etienne. And Fabio, you are recognized. Thank you, Alberto. I'm Fabio Bertano. I'm going to be moderating this panel, which is a name and opportunity for a welfare state in the region towards building universal, comprehensive, resilient, sustainable social protection systems. Before giving the floor to Mario Cimoli, Deputy Executive Secretary of ICLAC, I repeat what Alberto said before. For the one who have just joining to our session, remember that we have a simultaneous interpreting service and also sign language service. In the chat, you are going to, we're going to be gathering your assessment and as well as questions and comments. We're going to begin this panel with a presentation provided by Mario Cimoli. Mario, Deputy Executive Secretary of ICLAC since April the 1st, 2022. In the past, he was also in charge of supervising multidisciplinary work, substantial work, and in different developing talk. And this is Mario has a PhD of Sussex University in the United Kingdom. I would like to invite you now for your presentation. You've got 20 minutes now for your presentation. Thank you, Mario.
Fabio.
Sí.
Sí, mira, Mario.
Fabio, there has been an urgent call for Mario from UN New York, so he has asked me to begin with the presentation and, of course, apologizing. The audience, I don't know if you can see the presentation. Yes, we can see it. And as we need to be prepared for all contingencies, I now recognize you, Alberto, so go ahead. Thank you. I start by greeting the authorities that will attend panel number 1. And as it says there, we are before a series of crises, simultaneous crises. The pandemic generated a health crisis. At the same time, an economic crisis. There is a social crisis. We are in a macroeconomic moment of important uncertainties with economic slowdown in the region. There's a moment of turbulence insofar as what ECLAC has said, the effects of the war in the region. Yes, there is a time for greater need of social protection, for greater certainty, greater universal, comprehensive, integral, sustainable, and resilient protection. And as I mentioned, there has been a sequence of crises. There you can see on the graph the correlation between GDP, which is on the right side, and the trade volume, where you have in the 90s a peak of a boom of globalization. Then we have 2008, the international crisis with a substantive drop of the trade volume and GDP. And it takes several years for the region to once again have recovered those levels. And after economic tensions and policies with China, we have also the pandemic starting 2020. This is the third year, the Ukrainian war. or war in Ukraine, a series of crises impacting the region. And thus, expectations have grown worse. I was mentioning that in one way or another, the GDP growth in 2022 is declining. You can see the forecasts in war in blue and the present forecast in black. They are all declining, going down. And with a process of inflation, yes, persistent inflation, the region, in view of this uncertainty, has ECLAC has just presented an economic study for Latin America and the Caribbean, and thus we have a slow down in growth. There is deceleration, and our estimate is Latin American and the Caribbean will be growing 2.7%. And of course, the region has different results, but basically there is slow growth. And along those lines, this growth is not enough to recover participation and put an end to unemployment, especially of women. On the right side graph, you can see the underemployment rate, total one, and women's unemployment, which is the blue bar. Pre-pandemic, there was a 9.5% or 9.5 points. Today, it is 11.6, 2.1 percentage points higher of female unemployment. And there is 9.4 in men vis-a-vis 7.9 that of 2019. So there has been an important bounce back economic recovery from 2020. But in 2022, this recovery is slowed down. And what happens in the labor market is that there are important lags and gaps, maintaining millions of people unemployed, more than what you had before the pandemic. And this occurs in a persistent inflation context. 2 years of price rises, price increases, starting in April, May of 2020 to May of 2022, there has been a persistence in an increase of consumer price indices. And that clearly shows, as we will say later on, this involves complications not only in the productive and economic world, but in the world of social development, and especially in the world of most vulnerable people, where inflation strikes them with greater magnitude. And in view of these inflationary processes, the central banks increased the monetary policy rates and reduced the growth in the monetary base. And thus, what ECLAC has done is to have a core and have macroeconomic, fiscal, and monetary policies to be integrated so as to face this process of uncertainty and crisis and higher inflation. And this also occurs with high debt, tremendous indebtedness. You can see that on the left side graph, the level of debt shown by the region, around 52% of GDP, is similar to the highest figures of 2002, 2003, beginning of this century. And in fact, there's a total expenditure of central government since 2020 in view of the many emergency cash transfers in social protection, mainly non-contributory. One of that 10.2% went down to 9.3%, and the forecast is that it will be back to pre-pandemic levels of 7.8% of GDP. And in that context, basically, our forecast is that unfortunately, we will face higher levels of poverty and extreme poverty. Our estimate is that 8 million people will have food insecurity, and this is linked to the FAO report a couple of weeks ago. And there is an estimate that we've done for 2022, published in the policy brief of ECLAC a couple of months ago, where poverty is increasing. And we estimate, unfortunately, that extreme poverty will continue on the rise. In spite of economic recovery that is being slower in 2022 versus 2021, the extreme poverty will continue to increase. And you can see that our estimate of 2021, 13.8%, was in a context where the region grew in average 6.5%. Now the region will grow 2.7%. And in fact, there will be an increase of extreme poverty. That's if we make estimates with a very high inflation, today it's reaching 14.9%. And there are low-income households with this inflationary process is very much concentrated in the price index of food and of energy, transportation. In some way, external matters, yes, but are generating an important process, and where you can see that estimates of inflation for per income quintiles, that of less income will have 1.5 percentage points higher than the 15th income quintile, which is 7%. And unfortunately, inequality increases. The estimate we conducted in 2021 vis-a-vis 2019 and 2020 is that for the first time since 2002, we have a Gini that is on the rise. Those are bad news indeed, where the effects of the pandemic not only have brought greater poverty, extreme poverty, but greater inequality as well. 2.3 million deaths, in excess. This is 15.3% of the world's excess. Basically, pandemic has generated not only more mortality and death due to COVID and infections where there is a record of contagions in the region, but there has been an excess mortality. And Latin America, dosing of Latin America doubles, is twofold that of Europe. And this impacts on informal employees, vulnerable populations that live in poverty. And this is basically estimated in 15.3%, that world excess mortality. And basically these 2.3 million people in some way place an indicator that is regrettable, where we that account for 8.4% of the population represent the 15.3% of excess mortality worldwide. And in view of the impact of the pandemic, send messages to strengthen social protection systems, where there is a lack of permanent instruments and universal systems of social protection between 2020 and 2022, the 478 emergency measures, especially in the non-contributory help, where they can help 50% of the population, and where there are high gaps of coverage and demands, where unemployment insurance with very low coverage and insufficient. Only 8 of the 33 countries of the region do have this unemployment insurance. And six of them increased in coverage, yes, but where health systems are underfinanced with high levels of segmentation and fragmentation, and coverage of pension systems which are insufficient and backward, where the pandemic has generated less coverage of pension systems. And basically is that the recovery from the social crisis, we expect it's going to be slower than the economic recovery. You see on the graph other times of crisis where GDP, per capita GDP, took 14 years to recover. And basically, at that moment, the recovery of poverty levels took 24 years to recover. The backwardness we've had in extreme poverty is 27 years in the region. And how long will it take us to recover the poverty levels? In some way, will depend on the strengthening and investment made in social protection systems, and at the same time need to be universal, comprehensive, integral, sustainable, and resilient. And social protection is indispensable so as to have a drive towards sustainable development. And the engines for sustainable development are there. In some way, we need to reduce uncertainties and structural weaknesses, which are the basis of a social pact to invest in strategic sectors, giving social, political, and economic stability. We need to move towards a universal, integral, sustainable, and resilient social protection systems within the framework of a welfare state. And thus, we say that, of course, leaving behind those policies centered in subsidiarity so as to consolidate social protection systems with an approach of life cycle strengthening contributory coverage and expanding coverage, providing integral guarantees of social protection, establishing links with labor inclusion policies, to invest in capacity building, education, access to social protection and care policies. And also, it is important to strengthen social institutions, social sound systems. We need to have sound systems of social institutions to face inequality. And in that context, it is necessary, and with this I close, is to move towards a fiscal social pact for financial sustainability of social protection, which is indispensable for universal social protection, addressing challenges of coverage, and that needs to place in the center solidarity in access and not to be restricted to the levels of contribution of citizens to access social protection, and enable progress in order to reduce informality with universal access to pension and health systems, especially in the contributory social protection. Consider progressiveness towards universalization of social protection, and with a perspective and having financial sustainability. They are intergenerational, and in order to comply with the commitments of social protection in time, in the future. It is an opportunity provided by this pandemic to transform pension and health systems to new social and tax pacts that should contribute to the inclusive social development. Investing in social protection is moving towards inclusive, transformative social protection systems with gender equality guaranteeing financial sustainability to face inequality, which is an obstacle for sustainable development. Thank you.
Thank you, Alberto. Thank you for providing us with this outlook of different macroeconomic variables that is of concern, but also to identify a scope for opportunities and to prioritize the dimensions that relate to this necessary fiscal and social agreement. I would now move on to the second part of our panel discussion involving the participation of ministers and government representatives, and I would like to introduce them one by one. Several have, let's see, our first commentator will be the Minister of Social Transformation, Development of Human Resources and Blue Economy of Antigua and Barbuda, Honorable Minister Dean Jonas. He is presently, as I said, Minister of Social Transformation, Development of Human Resources and Blue Economy. The minister also presides the presiding officers of the Regional Conference on Social Development of Latin America and the Caribbean. As we all know, the importance for the UN of Latin America and the Caribbean and of this sub-region is absolutely fundamental for the harmonious development of the region. And the Honourable Minister has also acted as the joint spokesperson for the Chamber of Representatives and as President, Chairman of the Board of Transport of Antigua and Barbuda and Chair of the Board of the Authority for the Control of Development. He studied in Essex in the UK in the areas of electronic engineering and telecommunications, and has also studied in the West Indies University and also at the University of Essex and the University of Cornell in New York.
Thank you very much. And I'm glad to be here. I'm hoping that everyone can hear me loud and clear. I'd like to...
we can hear you. Thank you.
Okay, great. I'd just like to acknowledge the presence of all the other ministers of government that are present here today, as well as the directors of PAHO and the ILO directors, and all our other distinguished guests who are here today. I will try to share my screen with you. I'm going to see how successful I am to try to put up a PowerPoint, and it is not allowing me to see that. Share sound, video, what is going on here? Just give me a moment there. Let me try to share my screen with you.
Sure, no problem.
So you may have to go open the PowerPoint.
Yeah. Where's that? Yeah, but it's not allowing me to share this screen.
Yeah. No, open your file first.
Ah, you got it. All right. Thank you very much. As I said, someone shared it for me. Great. Appreciate that very much. And I appreciate the presentations that were done before. They were excellent. But just one other thing I just needed to point out, as you know, I have chaired many meetings with ECLAC before. And, we do have Spanish as well as English persons online, many persons from the Caribbean. And it would be great if most of the presentation, I'm guilty of it too, because I think my presentation is just in English. But it would be great if we had them in both languages together. I will endeavor to ensure that we translate ours to Spanish as well as English. And it would help a lot for our productivity if we also, if everyone did the same thing. So going forward, I would really appreciate if that were the case from everyone. Okay, thank you. Can we go on to the next slide, please? Yes, the protracted COVID-19. I'm going to really focus on what we have been doing in Antigua and Barbuda. And so this health pandemic has impacted every aspect of our lives, such as labor, social security, health, pension systems. And it has had a wide and further to have widened socioeconomic gaps and inequalities, especially in our tourism industry, which has been very fragile. So the strengthening of social protection and social security systems and the gains of progress that such systems made over the years faced devastating setbacks and the regression that surpassed any natural disaster recovery that we have ever seen. In the past, when countries such as Antigua and Barbuda met with challenges of a catastrophic climate event, the recovery period has been relatively shorter and faster compared to this current health crisis. So the social and economic resilience of the citizens and government in light of natural disasters has always been admirable. The next slide. From the onset of the global health crisis, 71% of the working population employed mainly in the service and tourism industries were the most heavily impacted, as we saw unemployment surge in Antigua and Barbuda. This also caused ripple effects as we experienced an immediate decline in our country's GDP and contributions to education, health, and social security systems. More specifically, we had instant shortfalls in contributions. As much as 41% of receipts disappeared completely. This made it difficult to provide short and long-term coverage to beneficiaries, inclusive of pensions, funeral grants, invalidity benefits, and sick and maternity leave with the mandatory national shutdown and closure of our borders. This basically continued with mandatory curfews, limited business activities, and restricted operating hours. As the country opened, the next slide, as the country opened to some levels of normalcy, there were and still existing some tourism service industries that account for approximately 10 million East Caribbean dollars in social security contributions that have not been recovered. As of August 2022, Antigua and Barbuda, with an approximate population of 100,000, have had 8,900 COVID cases, with 8,751 recovered cases and 145 deaths, and currently 53 active cases. Approximately 75% of the total eligible population, 12 years and older, that is approximately 62,000 persons, have been fully vaccinated, while partially vaccinated accounts for some 2,500 persons, 2,005 persons are. However, even with the high rate of vaccination compliance, the rates of infections were and remains highest among the working age population between 19 and 64 years, with over some 6,700 persons who are also the economically active population and the main contributors to social security systems. Next slide. This in itself provided a challenge, as there was an upsurge in the short-term claims, such as sick leave benefits, funeral grants. As a result, this cohort of the population, the economically active, were now the frequent unhealthy population with the recurrent sick claims, regular quarantine restrictions, and overall disruptions in business activities. Funeral grants also increased, as the system saw a combination of deaths directly and indirectly related to COVID-19 and those of natural causes. With the surge in maternity claims came mixed results, as the demand for quality social protection in the form of Social Security, long-term benefits further increased. On the other hand, with the aging population, like most of the other Caribbean islands, an increase in birth rates, albeit a short-term goal, with little to non-existent infant or maternal mortality, was a welcome benefit to our aging population issues. Invalidity claims have also been increasing as a consequence of the intensification of non-communicable diseases such as hypertension, diabetes, cardiovascular diseases, glaucoma, asthma, and cancer, rendering it impossible for some persons to maintain full-time employment. As a result of the pandemic, A transition into remote work led to a reduction in full-time employment. As economic activities commenced, thriving again, several business models evolved into part-time employment or full redundancy arrangements, resulting in immediate unemployment and part-time employment increasing from approximately 300 to 400 persons to approximately 700 to 800 persons overall, directly impacting Social Security and medical benefit receipts. Generally, the strain on the health sector highlighted the limited resources such as beds, ventilators, PPEs, medications, other equipment, and so on, and an increased demand for healthcare professionals and services, inclusive of mental health and psychosocial support, geriatric care, and sexual and reproductive health care. What opportunities? Opportunities to advance towards a welfare state and solutions to the protracted crisis. The demand and pressure on the government to provide adequate, quality, and timely social protection as it relates to Social Security and medical benefits are never ending. In looking ahead, as a country, we have yet to see what the full impact of long COVID on population will look like. As we are now painfully aware, it will show its ugly head. Ideally, in the Caribbean context, Social Security, medical insurance, or benefits should have a contingency reserve in place that covers at least 3 months. However, in Antigua and Barbuda, we have only been able to safeguard a 1-month contingency reserve. As a consequence of the pandemic, the immediate shortfall on long-term benefits, such as social pensions, had delays up to 3 months, while short-term benefits experienced up to 6 months and possibly more. Therefore, to remedy some of the interruptions, which directly impacted the Social Security systems, such as health and pensions, the central governments had to provide net transfers or subventions to the various systems, which are operated by quasi-government agencies, namely the Antigua and Barbuda Social Security Board and the Medical Benefit Scheme, as well as the Social Protection Board. This was to allow the continuous flow and quality of social protection assistance. For the most part, central government provided up to 70% of the transfers until contributions were stabilized, which provided adequate coverage of social pensions, which are now current. Consequently, the Antigua and Barbuda Social Security Board had to source additional funding from the central government for short-term benefits coverage, such as sick leave, maternity benefits, and funeral grants. In addition, there was a significant increase in the health sector expenditure, equivalent to 0.5% of GDP, was directed towards the purchase of critical medical supplies, equipment, and personnel. One of the most important socioeconomic effects of the pandemic, which rings true for most Caribbean territories, is the absence of unemployment benefits or insurance for formal and informal workers. The establishment of economic impact payments or stimulus mechanisms will be critical for instances such as COVID-19 or any health pandemic, natural or man-made disaster, and future economic crisis. There is a CARICOM proposal for all the Social Security agencies in the Caribbean region to tackle this very issue of unemployment insurance that should be sustainable to mitigate against any future risk. Additionally, allocating a substantial amount equivalent to 3 to 4% of GDP towards a contingency reserve for Social Security systems in order to alleviate hardship to a most vulnerable population, while strengthening our social protection mechanisms as we transition to a modern welfare state. Thank you very much.
Thank you very much, Honorable Minister Dean Jonas, and thank you for sharing and highlighting the situation of Antigua and Barbuda in the response to COVID, to the pandemic, and the challenges. And I think that you have highlighted pretty well the key role of social protection for Caribbean countries during the pandemic and the challenges ahead. So we are going now to pass to the next participant in the panel. Permítanme pasar al español y me gustaría invitar a...
I would like now to invite the Minister of Health of Chile, María Begoña Yarza, for comments. She's a surgeon by profession, a specialty in pediatrician. She's got a master's degree in public health from Pompeu Fabra University in Barcelona, Spain. She studied a PhD degree as well over there. She has exercised as Deputy Director of Clinical Hospital San Borja, in charge of processes of Ministry of Health, and High Public Directorate of Hospital Ezequiel González Cortés. She has been working as Director of Metropolitan Health Service in the Southern area, Director of the Academic Committee of the Chilean Society of Quality. Minister, you are recognized. You've got 15 minutes. It's a pleasure to have you here.
Ministra, quizás tiene el micrófono apagado.
Minister, I guess that you are on mute.
Ahora sí. Está prendido.
Okay.
¿Usted nos escucha, ministra?
Can you hear, Minister? We cannot hear you.
Si le parece, ministra, podemos ver cómo resolvemos.
We can probably assist you with the technical problem,
Sí la escuchamos, ministra.
but
Se apagó el micrófono. Ahora sí.
okay, we can hear you now. In relation to social security and health, our government has involved in transforming the Chilean health system towards a system that provides guarantee access, quality of care to the whole population of Chile. We are now in a country that, apart from the element that the former Minister Jonas said in terms of the pandemic, can you hear me well? What the minister said that was related to the consequences of the pandemic as impact that shows in a more dramatic and clear way the reality of our country. In the Chilean case, apart from that, because of the demographic profile and epidemiological profile that we have gone through over the years, we are in 2022 where more than 11 people have some chronic disease. What makes that the burden of diseases for the health system is going upwards, that the obese population and with morbidity from the point of view of obesity has increased since the last health survey that goes back to 2017. And so there's no survey where this condition is not surfaced. So when we are focused on the challenge for the health system in Chile, we have to start from there, taking into account these conditions that we need to look at the system as an instrument of the state to respond to these problems and take charge of these health conditions. But the Chilean health system has also similar features to the ones of the Latin American countries, where the funding is segmented and the supply of services is highly scattered. So health and access to health coverage and health results will depend on the payment capability, how much they can afford to pay for health care. When we look at funding, then the individual who is part of the FONASA system, which is more than 15 million individuals, they have 35% more risk than the rest. Here we have people over 65 years old, below 4 years old. The population that has more diseases is exactly that group. And on the contrary, the individuals who belong to the private health sector, they represent 3 times higher expenditures than the FONASA capital. So we have people with more risk and with higher expenditure where in the public sector, and the younger people with less health risk are the ones who are under the ISAPRE system. Now, when we look at coverage and access to services, we can realize that the difference between people in FONASA and the ones in ISAPRE with health problems such as diabetes, 12.7% of the Chilean population, of depression, 5% of the Chilean population. And if we compare that, we can realize the effective coverage of the individual in SAPRE is higher than the effective coverage of the ones who belongs to FONASA. So the access to these services according to the health security provided, access to a specialist and access to dental care is clearly different, with high access to the health system to those which are under the private sector, the ISAPRES. With an example here, infant mortality, where we see how the health system tries to resolve these inequalities, systemic and cultural inequalities. And an example that we have here is that those individuals, those communities in the lowest economic sector, they have higher infant mortality compared to the ones with the high economic income. The ones in the lowest sector are under the FONASA systems, and the other ones are in the ISAPRE system. That means that the average in Chile, that is 5.7%, is not distributed equally, and it is expressed as inequality, not only economic inequality, but also territorial inequality. Another inequality has to do with the impact of COVID-19. When we look at the impact of COVID-19 in the countries of Latin America, we have to see not only the distribution, but also something relevant, that is mortality, and the excess of mortality in Chile compared to middle income and high income countries. We are in the third position with the high mortality rate. That means that when we compare with countries with lower income levels, we are favored. But when we compare to equal incomes, Chile had an excess of mortality. Also, the study that we're not showing, but a classical study that were performed at the beginning of the pandemic, any age group in Chile in relation to mortality, but distributed in socioeconomic terms, in every age group, this was easily predictable that that sector will have high fatalities. So the health results experience the consequences of a scattered system. From the social and political standpoint in Chile, as of October 2019, we have a social movement which states that won't accept the conditions which are related to access to social security. People were saying that one of the elements that they expected to be changed in Chile are those related to the health systems. So for the individuals, the health systems and changes and transformation are related to those coming from the transformation. When we were going to the different street demonstration and marching people, and we could read in different cartels there very frequently the health problem. So they said that they wanted a health with dignity. That was an ethical questioning in terms of access, coverage, and quality of care provided to some sectors of the population. So from the structural conditions of the health systems, plus the subjective conditions of the society, is that the government program of President Boric includes very significantly the health reform and the transformation of the health system. And this is reassured in June the 1st in the first public account, where he says that a project will be submitted beginning a road towards the reform based on a universal health funds. And with that, we could have a system that could provide with the foundations of to this transformation. And we were dreaming of a reform that could be systemic, including not only solidarity in terms of payment, but also in terms of service provision. We think that services should be reintegrated, should be restored with gender consideration, territorial considerations, and especially at the primary care level, and with an important focus on citizen participation, deliberating and binding, going in hand with more democracy. We think and in a systemic reform to consolidate a universal system, but also a system that should be resilient, sustainable in time. Here, I'm showing you the main aspects of our reforms, which cover all the different aspects of the health reform, including the health environment, that we think that this is determinant in health. So changes in the environment, laws promoting healthy life and healthier community is essential. And we are suggesting a universal health fund including all the areas and transforming this into a comprehensive and universal system. We have started with this. The reform has already started, and we have a universal council, a universal board made up by ministers of all democratic governments with civil society, professional associations, representatives of municipalities, governors, political civil society, but also all this has been a starting point for this universal health provision. Some weeks ago, what we did is that we launched a policy that is going to be effective as of September the 1st, and that means that no individual under the FONASA system will be paying for attention. That is a copayment equivalent to zero. And that's for the public health system. And this is the first step of what we want to do, that is the national health system. And I can tell you that the experience of every country, Latin America and England, etc., they are all very inspiring, but I want to tell you that we have this since 1952. In that time, the Senator Salvador Allende, plus Dr. Eduardo Cruz Coque, one conservatives and the other one socialists, they dreamt of a national health system. And we as government, we have been inspired by that history. And as the president said, the transformations are done on the shoulders of gigantic people such as Salvador Allende. And this is the road that we are walking now to have a fair, equitable, inclusive health system, resilient and sustainable. Thank you.
Thank you, Minister Yarza. Very interesting. The figures and eloquent review of that epidemiological transition of Chile with and the overview of inequities or inequalities in coverage and access, and especially the outcomes. Thank you for sharing these main guidelines of the health reform you're working on. Allow me now to move to the next speaker. We will invite the Minister of Honduras Social Development Secretariat, Mr. Carlos Cardona. He graduated in social sciences, in history, and higher education in science and political theory, and specializing in epistemology in the Latin American Council of Social Sciences, FLACSO, has participated in university reform in Honduras, a political analyst of the national situation in different digital and printed media. He's one of the youngest ministers of the country. So, Jose Carlos, it's a pleasure to have you. 15 minutes are now yours. Yes, we can hear you. Thank you, ECLAC, for the participation and the organization of a seminar of this kind in collaboration with ILO and PAHO, and this joint work with German cooperation and EU. Thank you to all those participating in the organization. Now, to say that pandemic evidenced the frailness of our country. It's no secret that Honduras is one of the poorest countries of the Western Hemisphere, only behind Haiti and Nicaragua. We are behind in the continent in social economic development. The pandemic of COVID-19 plus hurricanes involved a retrocession in living conditions unprecedented in our history that we went with data going back to 1949. The GDP fell 9% a year. The physical damage and ruins left 8% of drop of GDP, and poverty increased 14 points. This has left the countries without digital connectivity, backwardness in health system, all the indicators that we had achieved, what we call in Honduras the 30 years of political transition between the constituent and the coup d'etat in 2009. The welfare state has weakened in these last 20 years with crisis of governance impacting on the population and damaging the institutional capacity of the state to respond to the crisis and moving. So at this point, we have 73% of households in poverty, and the level of formal unemployment doubled in 2020, even in rural areas. In this context, there are major social gaps that promoted incentives to migrate. We know the situation of 400,000 Hondurans, the famous migrant caravans, a news that had echo in the whole world. Complex scenario where 1 out of every 4 students of 6th or 8th grade have a possibility of migration. We are the most vulnerable country environmentally insofar as climate change. Environmentally, we are the most vulnerable one in the world. According to ECLAC, these storms and crisis, what opportunities are there to move forward in social protection within the framework of a welfare state? The government that has just started its mandate has a proposal of building social protection with a new framework law of social protection. The existing social protection law has been repealed, one that authorized the state to use pension funds in order to invest privately and to create private investment funds at very low rates. So the profitability of pension institutes, which were the guarantors of our very incipient social protection, were weakened, and all the pension systems in Honduras are on the verge of collapse due to the ill use of these funds. President Castro has a proposal of redesigning the social system articulated by the different secretariats. In our case, Social Development Secretariat has the mission of building a new social protection system with national coverage and that can encompass everyone and be able to connect with the Sustainable Development Goals. The vision is to have in 2030 at least a social protection system and a public general policy of articulation and coordination. We poor countries cannot afford intervening and making interventions or social projects without having integral involvement of all the institutions of the state in the social arena because resources are very limited. Well, what are the key elements to form a social pact to allow us to transit in that direction? First, the Social Council of Government, to be installed in the coming weeks, seeks to articulate and coordinate all these secretariats that have been reproducing efforts. There are 2 implementers and 2 programs validated by international banks and have been also made social in ECLAC. The program of Solidarity Action and Solidarity Network. These 2 programs gradually seek to reduce extreme poverty indices that are almost 54% in Honduras. social solidarity action is one that has focused on certain vulnerable groups: the elderly, disabilities, migrants, persons with HIV, vulnerable mothers, persons victims of natural disasters, persons of social diversity, indigenous peoples, among others. The idea is to build strategies focused on intervening in these vulnerable groups in parallel with the combating of extreme poverty and the framework law that we are working with several civil society organizations to bring all that to the Congress and set the basis for building a true new framework with the prevalence of integration strategies that have never, including those that have never benefited from social protection. We are speaking about social, health, and education services for people of extreme poverty, where the famous profound deep state does not work, where there's no health or education coverage policy, and the decision of the president to resume massive literacy campaigns, and all of this with a sophisticated monitoring program allowing people providing social or humanitarian help to see that resources are being prioritized and are being adequately, duly used. In spite of the bad things we experienced, we are setting the basis for a new protection system that will allow us to have a new vision towards the future. Solutions are not given right now. What we are doing is creating the grounds, the basis for adoption of measures in the future. FAO is saying that we are in a humanitarian crisis of more than 1 million people with hunger in Honduras. This is exacerbated due to global warming, and all the strategies adopted in these 7 months will lead in that direction, seeking a social protection agenda with a program of activities and joint strategies of all public institutions so that the final outcome and product will be this desired social protection system adapted to the reality of a country like ours. We need to share experiences and lessons learned in other regions, but it's important that we articulate joint efforts in order to share the tools that we have in the countries, and for our case, which we are a country that starts to reconfigure its social public institutions to see how we can bolster the system and strengthen it. Thank you very much, and we continue available for questions or comments. Thank you, Minister, for this description of a complex scenario, just like other countries of the region, and for adding these unique characteristics of countries like Honduras, like migration phenomenon, vulnerability to climate change, and that process towards building new bases for a new social protection system when you move from the juncture, from the crisis, to a state where these pillars can be built for social protection. Allow me now to move to our next panel member and allow me to introduce the Undersecretary of Social Welfare of Mexico, Mrs. Maria Perez. She was appointed by President Manuel López Obrador as head of the National System for Integral Development of the Family, National BIF, and by the Health Secretary, Jorge Carlos Alcocer Varela, President of the National Consultative Council, until January 1st. Throughout her professional career, she has been advisor to Government Secretariat, Assistant Director of Social Communication, Director of Protection of Tourism, and Secretary of Tourism in Mexico. Undersecretary Garcia Perez, thank you for sharing your experience. The floor is yours, and you have 15 minutes.
Thank you very much. Good afternoon, everyone. And I greet all of you that form part of this panel. The moderator, Fabio Marzano, director of the ILO office for Southern Cone of Latin America, and the acting executive secretary of ECLAC, Dean Jonas, Minister of Social Transformation, Development of Human Resources and Blue Economy, of Antigua and Barbuda, Maria Begoña Yarza, Minister of Health of Chile, José Carlos Cardona, Minister of the Social Development, Minister of Honduras, and to the advisor of presidential advisors of Argentina. I would like to thank ECLAC for the invitation to participate in this second regional seminar on social development, with the issue an opportunity for a welfare state which is strengthened in the region and towards the construction of social protection systems that are universal, comprehensive, resilient, and sustainable. I would like to congratulate the representative of ECLAC for his extraordinary presentation and to say that the general concepts that have been shared here are coincidental. In fact, with the efforts that the government of Mexico has done, headed by President Andrés Manuel López Obrador, and that seek to build a fairer society where no one is left behind and no one is left out, via the instrumentation of a comprehensive and sustainable development model that provides social protection to everyone, prioritizing those that need it most. As from its creation, ECLAC has insisted on generating a sustainable development proposal for Latin America with the purpose of facing up to the multiple crises of the region. And over the past decades, its position has been a driving force in order to promote productive development, accompanied by a social policy that helps to redistribute equitably, redistribute wealth equitably generated by society as a whole. And in a sense, for President Andrés Manuel López Obrador, the change in social policy is one of the many transformations underway in Mexico in order to consolidate a welfare model that prioritizes the most vulnerable groups. Thus, programs for welfare promote a new inclusive development model that goes beyond the generation of wealth and distributing it in the most equitable manner, because it seeks to create the conditions that enable the full exercise of rights of all citizens in Mexico. As occurs with the Sustainable Development Goals of the 2030 Agenda, the National Development Plan of Mexico puts forward an alternative model that breaks away from individualistic perspectives and promotes a social policy in order to gain access to material factors and to a process to reconstitute the social fabric. In this sense, it is fundamental to incorporate to this work that is undertaken by the principles of universality, mainstreaming, intersectionality, sustainability, and care. In other words, we need to promote an institutional re-engineering that enables us to learn in a comprehensive manner from all sectors in society, without conceiving beneficiaries of social programs as mere receivers of aid, but rather as subjects that contribute to the transformation of the country. Unlike previous administrations, the present administration in Mexico caters for the most unprotected, unsafe, and needy communities that today have opportunities to develop freely, because social programs are no longer gifts that are directed, focused, and conditioned. And with the restructure of the public expenditure, we have done away with second-class citizens. Programs aimed at welfare were planned as from a rights approach, and the vision of the government redefined the role of the state, making it the main insurer of the free exercise of rights, whilst the public sector recovered its place in the economy with the creation of employment in programs and regional programs and infrastructure works, and in strategic spheres such as the energy and health sectors. In parallel, we launched a collection policy that has enabled us to alleviate the inequalities generated by the market economy, opening up a horizon of social justice, despite the fact that the development model in Mexico includes economic growth without undermining the welfare of future generations. It prioritizes activities aimed at satisfying needs that bridges inequality gaps. Neoliberal governments in Mexico transferred to the market the substantive functions of the state in terms of health, education, and social security. Thus, the present government recovers those rights with an improvement of the efficiency of public management through austerity and struggling against corruption. Never in the history of Mexico had we had a social policy that could have so many beneficiaries as the present programs for welfare. We have achieved the universality of programs for the welfare of the older population, and that has been the result of an increase in social investment. By taking these programs to a right which is consecrated in our constitution, the Mexican state guarantees that over 10 million people older than 65 years of age receive a non-contribution based pension. Along the same lines, we find that the pension, the permanent disability pension, to date, as a result of the collaboration of state authorities, we have achieved universality in 13 different states of our country. Last year, via welfare programs, we have catered for more than 23 million people. And this means that 65% of Mexican households receive at least some support. And for this year, the budget allocated to social policy increased by 30%, which is equivalent to 445 billion pesos approximately. And when we began the administration of President Andrés Manuel López Obrador, 10% of our population accumulated 79% of the net wealth of households, and 40% of those did not belong to a social protection system. In consequence, the most urgent work was to cater for the task of the unequal distribution of resources. On the other hand, the forced isolation as a result of COVID-19 impacted all spheres of life, among them the economy. The recession of the global market and the increase of poverty indicators made the economic and social outlook much more complex throughout the world. ECLAC anticipated a drop in GDP in the whole of Latin America. In Mexico, we foresaw a drop of a 9% drop. In accordance with that scenario, the GDP, this would imply massive unemployment and thus a drop in family income. And in fact, that even middle income groups, because they were not direct beneficiaries of a specific public policy, would fall below the welfare line. Within this context, studies produced by ECLAC revealed that countries that chose to increase public debt in order to finance greater public expenditure in order to mitigate the crisis are suffering severe consequences, because in addition to making their recovery much more difficult as a result of the global increase in interest rates has made that they have suffered. Mexico reduced its current expenditure and redirected its resources to the health sector in order to reduce the social and economic impact upon our households. Our efforts focused on 38 priority programs, and out of which at least 19 were aimed at the most vulnerable groups as a result of the pandemic. As from the very onset of this 6-year period, the government of Mexico promotes changes in labor insertion and social assistance programs. Thus, conditioned policies were substituted by non-contributory based pensions globally, and this increased by 0.23% of the GDP before the pandemic, and during the pandemic 0.7%. The expansion of social expenditure that was achieved as a result of a greater collection and lower operational costs. Despite the fact that the poverty rate increased from 41.9% to 43.9%, without welfare programs, this would have increased by at least another 2 percentage points. In other words, we prevented 2.5 million people from falling into poverty. In itself, no social program can significantly reduce poverty and disease. It relies above all on the generation of redistribution mechanisms that are effective and that improve working conditions. And thus, instead of focusing on isolated individuals at present, the social policy in Mexico deals with structural issues that favor the incorporation of the most vulnerable sectors. As has been mentioned, the social policy suffered important changes in 2019 in accordance with the IMF. The increase of expenditure and the efficiency of welfare programs helped to reduce inequality gaps, to mitigate the negative impacts of the pandemic, and to promote a recovery via an inclusive economy. Together with the policy of non-indebtment, programs for welfare have been the basis with which we have faced up to the crisis as a result of the COVID-19 pandemic. In the world, we have not experienced a shrinkage, a similar shrinkage of the economy since the Second World War. But despite that, we have experienced a gradual recovery with a great advantage that today we have a strengthened health system and a more efficient model to redistribute wealth. Before this situation, it is possible. As a result, it is possible to see that the effects of the present Mexican government social policy were much more effective in the short and medium term, especially for the more vulnerable sectors. In consequence, in Mexico, social justice promotes development from bottom up, and without excluding anyone. The equal opportunities generate a welfare state that upholds the construction of social protection systems that are universal, comprehensive, and with sustainable development. Thank you very much for listening to me. Thank you, Undersecretary. Thank you very much for that outlook and for summarizing in a few minutes the way in which welfare programs were the basis to promote a crisis response. So you have touched upon many important issues, among them the relevance of mainstreaming intersectorial nature and placing the population as subjects that are co-responsible, and how social protection is a tool to dignify people in their role in contemporary society. So thank you very much, Undersecretary. Now I would like to move on to our last panelist, who is Sonia Tarragona. She comes from the unit of the Cabinet of Advisors of the Ministry of Health of Argentina. Just a few words about Sonia. She belongs to this unit of the Cabinet of Advisors of the Ministry of Health of Argentina. She studied economics and holds a master's in public finances of the University of La Plata, and she has studied the economics of health and regulation of public services. She has been the director of the master's course on pharmacopolicies of Universities y Salud, and has been a lecturer at a graduate and postgraduate level at the Universidad Nacional de La Plata and Universidad y Salud. Sonia, you have the floor. You have 15 minutes, up to 15 minutes. Thank you very much.
Presentación para pasármela o la comparto yo. Ahí está. Bueno, en primer lugar agradecer a los organizadores del seminario, a la OIT.
I would like first to thank the ECLAC, PAHO, and German Cooperation Agency to organize this seminar, where we can share the experiences that all the countries have had in such a difficult situation as it is and has been the COVID-19 pandemic, and the impact on social protection systems, which have been greatly affected because of this situation. Historically, our governments, especially the central left governments, had been concentrated in the expansion of welfare systems by strengthening state capacities. Argentina has not been an exception, and the social protection systems as well as the health systems have facilitated the access to health, recognized this from our constitution. The public health, that means a state which is present and ensuring the health access to all the citizens. We have a health system which is universal, taking care about all the Argentinian citizens as well as foreigners, but we do not ignore the situation, as has been already mentioned, in terms of fragmentation and guarantee the access to health. In terms of the balance of impact of COVID-19 in the health systems and in regarding challenges that we already had, we have new challenges, not only local but global challenges, because this crisis, not only in terms of social protection, I'm not going to say anything new now, the impact of COVID-19 has had consequences that we cannot even devise. The mere fact of looking at this from an economic point of view and the impact in terms of global supply and demand has no precedent in our history. The countries in the world were demanding and offering the same things in the same moment. Systems with limited production capacities which couldn't respond to the demand of the countries, and very clearly the unfavored countries, especially in the regions of the Americas and in Africa, probably are the ones who have been more affected by this crisis. Specific groups of the population have been more affected, such as women who have devoted most of their time to take care of people affected by COVID, workers, informal workers, elderly people, girls, boys, adolescents. In the case of Argentina, half of children are living in poverty, as well as adolescents, lower of children below 15 years of age are living in poverty, and also the problem has been to be reintegrated to labor market because the domestic work has been multiplied in our countries. Is still job that is not paid, that is done more than 75%, and adolescents living in the foster houses. And which were the measure mechanisms which were, considered in our countries? We have the Federal Council of Health made up by the Minister of Health in the region and the Ministers of Health of the jurisdiction in our countries, and very frequently I would say that they were having meetings every week with the different ministers of health, and with political differences, even in terms of representatives of the provinces, but all the health policy reach agreement upon a strictly health approach, and that allowed us to take measures which were implemented throughout the countries to mitigate the impact out of COVID-19. The Ministry of Health during 2020, almost 60% was had more capacity compared to the former years. The Ministry of Health also was in charge of buying respirators and drugs, and with permanent boards setting up different teams buying input and supplies, which should be equal throughout the different provinces. We work with the health professionals, a very important of money transfers took place to the different provinces, amounts that exceeded 6 times the ones that were normally transferred. Vaccination scheme against the COVID was a strategy of the central government, and we worked very strongly in ensuring access to medications and vaccines in the work that was done on daily basis, resolving the difficulties which came up every day. In terms of the presence of the state, I can mention two main aspects of the presence of the national state at the regional level, strengthening, expanding the local vaccines production. I don't know if you know, but in Argentina, with the support of WHO and PAHO, where was chosen as one of the countries receiving the transfers, technology transfer from the technology for messenger RNA, which serve to be exported vaccines to other countries. At the national level, we are working in producing drugs. Also, the pandemic revealed the difficulties that we had for drugs supply and the challenges posed by the pandemic opens the need to counter information, especially working on the transformation towards digital health, especially for the most vulnerable areas. And we are working very strongly on an integration process because our system is segmented and it was very fragmented. But in Argentina, more than 60% of the population is served by the private sector. So if we wouldn't have the possibility to articulate with the private sector, the public sector wouldn't have been able to respond to the pandemic. In terms of priority actions, we have been working in reorganizing and integrating public subsectors, social security and private sector, and in 3 main areas. The first one is federal governance and articulation to put an order to the systems in the different processes, a new model of healthcare. We were working intensely in human resources in the health sector. Each provincial jurisdiction has its own authority to define the needs at their own territory. So we're required to have an intense work on the collaboration and articulation to make progress in equal basis in the countries, working on strategies of financing, access to technology is something that is of a concern throughout the country. Also, care about disability, which requires increasing financing, and we are working now in redesigning those strategies. Information system, scientific technological innovation systems, which should be in line with the proper health communication. You will all agree that communication has been an essential aspect when managing the pandemic, and when that's a lesson learned because we haven't been good communicators. We are making progress in a public health strategy to expand the primary care. We have still something, a pending task there, not only in the country, but in the region. And strengthening the prioritized health intervention for this year and next year, we have mainly focused on mental health and problematic consumption of substances, chronic, non-conveyable disease control and prevention, conveyable diseases also, prevention and control, and this has been all under a renewed approach. The health system and social protection system in Argentina has tools to ensure an effective warranty of social rights, which are the areas where we have to implement those actions to reach the objective of 2030 agenda in line with sustainable development. We need to build from evidence and experience. We need to have an opportunity to rethink of our social system, not only our country, but I think that this is a global perspective. We need international solidarity and cooperation, and we need to joint efforts in building a health system at regional level under all this principle of solidarity, mainly to leave no one behind, especially vulnerable groups and the most affected groups because of the pandemic. That is going to be the only way through which we can contribute to the ambitious goals in line with 2030 agenda. And something that our president always says is that we need to be able to build a normal condition, never the normal situation that we have in the past, but the possibility to build a new social pact with a new normality. Thank you. Thank you so much, Sonia, for going through the main policies and response measures in the face of the pandemic, also the health policy rights and other things that you have mentioned, which have been highly relevant. And the role of women during the pandemic. Mental health as an important debt, and also all what you have mentioned in line of a health system which is shared by other countries' federal structure with many problems to face these problems of segmentation in line with governance, human resources, funding, communication, technology, etc. I don't know if I have taken note properly about your proposal. But again, thank you so much to all the panel members. Thank you so much to each one of you because you adhere the time allocated to each presentation. If you can stay a couple of minutes to answer some questions from the audience, I would like to say first that we have had about 360 people online. They had left many questions and comments and concerns. Claudia Robles has been summarizing some interventions, and before going to the Q&A session, the Minister Jalsa had to leave for an activity that she had already scheduled, and she is apologizing for leaving the meeting. Special greetings to the organizers, she said. So some questions which came up from the audience, one of them is related to the critical points or aspects to strengthen institutionality in line with social protection to consolidate this proposal for universal, sustainable, resilient, and comprehensive social proposals. So would you like to mention some of them? That would be, that is one of the questions, and also other questions in line with the economic and social projections, how will they impact on the development processes, especially social development processes in the coming years? Is there anything in line with this? We consider not only the urban but rural environment as well. And finally, some concerns about what are the aspects related to the economy of solidarity, education, changes of the health system to reduce inequalities under the rights approach. So this has been one of the issues which have came up on the chat. I don't know if we can have, let's say, a round of answer by each one of you, 3-5 minutes each. And then I would like to begin by Minister Dean Jonas. Could you take the floor and give us your comments for a couple of minutes, and then we go around with the other panel members to close this session with Alberto Arenas. Minister Jonas.
Okay, good afternoon, everyone. I hope I understand the question clearly. Essentially, we clearly have to strengthen our social protection systems across the entire region. And assigning a percentage of our GDP towards our social protection systems will go a long way towards solving a lot of these social problems. You see, normally when disasters come upon us, whether it's health related or natural disaster related, the governments generally don't have the funding in place to support these things. So what usually ends up happening is that the Social Security boards, or if there are any statutory boards that are in place, they usually take the funds from these boards. But then later on, they suffer because then the funds are not available to pay pensioners and other things like that. And so what I think is needed, and one of the things that we're looking at, is to allocate a portion of our budget where these funds, maybe a percentage of the GDP, maybe 2 or 3% of GDP, would go into a special fund that will act as in a way where you save this money over time. And so whenever these disasters come upon you, you will be able to fund the thing. Or another way, I think SEDIMA, the Caribbean Disaster Management Agency, has recommended insurance, where governments could purchase insurance from a regional or global insurance company to help to fund or to offset the cost of funding natural disasters, whether they be medical or otherwise. So these are just some recommendations that we have that we put on the table. What would help a lot is if ECLAC, through or the UNDP, ECLAC, UNDP, could make firm proposals as to how we could approach this on a regional level for Latin America and the Caribbean. This would help a lot in making the case. You know, I'm the Minister of Social Transformation, but I'm not the Minister of Finance. But you know, so we do have to make the case to convince our colleagues, because you know there are a lot of competing interests. You know, education and so on compete for the budget. So allocating this is something that I believe if we took a regional approach to it and have ECLAC make the case to convince all regional governments that we all should deploy this, either through an insurance program or allocating a portion of our GDP to it, where the funds are put aside in a board or something where it's saved for that purpose. Either way would work, but the case would have to be made not just by the minister, but by taking a regional approach to this. I hope that helps.
Thank you, Minister. Yes, I think that is a critical issue in how to find a way to pool resources at the regional level and try to make social protection counter-cyclical and fulfill one of the major objectives of social protection systems. And thank you very much for your contribution. Permítanme pasar ahora la palabra a...
Allow me now to recognize José Carlos Cardona. Minister Yarza had to leave, so Minister from Social Development Secretariat of Honduras. José Carlos, can you hear me? No. Then we move to Maria del Rocío García Pérez, Secretary of Welfare. I don't see her connected. And so, Sonia, then. The floor is yours. Yes, please. Well, based on your questions and comments in the chat, there are several challenges, and as countries, the first thing we need to do is learn from the experience. So for us who have several years in public health, these are decades of facing the same problems, and that have been evidenced during the pandemic. If we don't take the opportunity of really making the most of this opportunity, it will be difficult to find another time. To give you an example that is not strictly related to social protection, but something of concern to our countries, is the discussion on access to vaccines, possibility of a waiver of patents or copyright. We haven't achieved that as a world, as a region, to achieve only that. So it is a reflection that we take up in our country. How are we going to do to transform what we need to transform? And the question is one thing at a time. You need to do it. You need to make progress in public health, in human resources, build and rebuild rights for those who are worst off. There are many vulnerable groups in our region, very much impacted. So we need to make a self-criticism so as to build ahead. We have started. There's always little time to do everything we want to do, but the challenge is enormous, and the responsibility we have, those of us in managing, it's also enormous. There's a lot to be built, to discuss, and this experience of what we have as countries is also a major learning, because you don't need to invent the wheel, but rather learn from the experiences and build ahead. Thank you, Sonia. Minister José Carlos, we give you the floor now. Yes, indeed, there are many parallel situations in Latin America after the pandemic. And what's evident is that neoliberalism and its model, what we've inherited, is precariousness of social systems that is unprecedented in history of measuring modernity and compared to social protection in Western systems. I think that the UN system, within the UN system, we had never had the levels of damage of social protection we are having now. Since the building of the welfare state and what was concluded in liberal democracies, the deterioration of social protection systems in Latin America is something that should call us to rethinking, and towards finding ways and see how vulnerability has been addressed. We have new challenges towards the future. Water is a social problem we cannot avoid. Climate change is already here. And also the emergence of a multipolar world that has implications on how the poor and persons of social vulnerability are treated in the continent. Because The geopolitical rationales have a lot to do in how social programs are financed. There is a Europe where President Macron has said in France that it's the end of the era of abundance. And we have a Germany that is at a crossroad on how to rethink their relations with dependence on gas or hydrocarbons, the climate issue, and how powers are going to re-guide, reorient financing and support to poor countries. We are facing a future with many uncertainties. The only thing that can save us is our coordination, we as nations, on social vulnerability and climate vulnerability, so as to have environmental and social justice and social protection for the rest of the century. I think there are sufficient elements in order to implement packages of action that will favor this search of needs and all the things we are doing in order to build sovereignties. And the examples of Bolivia should call our attention how to build redistribution equitable models out of the wealth of a country, the use of natural resources, but particularly the care for those most unfavored. And there are other experiences in the hemisphere, but with this new wave of progressive governments, will have a lot to tell us. We will be coordinated. We hope to be invited always to these panels in order to exchange views and experiences. Thanks again to ECLAC. We hope to continue being part of this major continental effort and initiative. Thank you, Minister Cardona. Now, we are reaching the end. It has been a long panel with many proposals and interesting ideas and thoughts on what has been done and concerns about future challenges. So I give back the floor to my colleague Roberto Arenas that will give us some final thoughts and invite you all to be here tomorrow. So Alberto, the floor is yours. Thank you. Fabio, I simply would like to thank from social development area of ECLAC and particularly the participation of the Honorable Minister Dean Jonas, President of the Regional Conference of Social Development for Latin America and the Caribbean, Mrs. Minister of Health of Chile, Begoña Otarza, Rocio Garcia from Mexico, and Sonia Tarragona of the Ministry of Health of Argentina, and also thank Fabio for having participated in the opening session and for the chairing panel number 1. And thank you also, Jose Carlos from Honduras. And in connection to the questions to the panel, some final comments that would be of significance. Social institutions, as Fabio was saying, is the basis that enables the development of public policies in the social arena. We would say it's the set of rules and organizational structures on which social policy is managed. And in that context, from ECLAC, we have said that social institutions or institutionalities made by the juridical regulatory dimension, efficient legal frameworks, organizational implementation, technical operational dimension with technologies, information technologies, and the 4th dimension is the financial dimension, where financial sustainability of social institutions is key to universal social protection systems that are sensitive to differences, integral in instruments so as to face the different social risks of populations, integral social protection systems that are sustainable, maintaining commitments in the different generations and resilient so as to have the capacity to face changes and crises. And thus, the pandemic called for an outstanding effort from all the components of social institutions, sectoral, health, social protection, education, so as to channel joint actions of the population. And it is important to say that all successful strategies of sustainable development will require inclusive social development, and every strategy calls for investment in social security, investing in pensions and health. And in this context, it's key to move towards social, sustainable and resilient health systems in order to face in a better manner crises and structural weaknesses of health systems and inequalities in the region, guaranteeing the effective right to health. And the pandemic has provided us with an opportunity to move to new fiscal and tax paths that will generate financial sustainability for social protection systems and an opportunity for the necessary transformations of pension and health systems, which will be the main ones of the next 2 days of this regional seminar. Tomorrow, Wednesday, starting at 10, we'll be considering pension systems, and Thursday also we'll see health systems and potential reforms of health. And you're all cordially welcome. And thank you very much for having participated in this first panel of the second regional seminar of social development. Thank you very much. Thank you, everyone. And you're all invited for tomorrow session. And thank you again for your participation. Hopefully, we'll see you soon. Good afternoon, everyone. Thank you, Sonia, for participation of the Ministry of Argentina.
Thank you very much, Honorable Jonas, Minister. Thank you very much for your participation in this panel. We'll see you in Cuenca, Ecuador, I hope.
Thank you, everyone. Goodbye.